All right. I think we are live in our Facebook page, Alzheimer's and Dementia Support Group. I see that we are live there in Alzheimer's Dementia Support Group. Again, thank you. Thank you very much for waiting. Oh, let me turn that off a little bit. I got some feedback. I'm looking at my cell phone, ladies and gentlemen, because I wanted to know if we are live. But if you are watching live, please comment live. If you're watching on the replay, please comment replay. We want to know if you are here and we can provide awesome value for you. But tonight is what we call the Tuesday Dementia Training, wherein we interview the certified dementia practitioners, different therapists, different practitioners on how we can bring out the best in you as an Alzheimer's caregiver, as a dementia caregiver, as a dementia care partner, and actually also how to be the best that you can be for yourself, for your loved ones, and also for the clients that you serve. So again, today we have a special guest. It's my first time to interview a speech therapist, so we might learn a thing or 2,000 from them, because speech therapists are very, very valuable when it comes to dementia training. So again, we got a special guest, Christina Macauley. She is MS-CCC, SLP, CDP, ABC, name it. I think she has it. But she is here to teach us, some a thing or two, like what I said, on how to be the best caregiver, best care partner for our patients or for our loved ones. Talk about Alzheimer's and dementia. Again, Christina, I hope I'm not talking too much. Go ahead and tell us where you're from. What do you do? And give us some tips here, Christina.
All right. Thank you so much, Dr. Mike, for having me join today. I am really excited to be here and to get to share with the crowd what SLPs can do with dementia and why we can be a part of this group. I hear a lot of the times it's, well, dementia and Alzheimer's, you're at the end stages. Why would you do therapy? And one of the biggest things is that we can still test your functions. We look a lot at your speech, your language, your thinking. If you have any swallowing difficulties, we help with that. And ultimately, we help you maintain the quality of life and make things a little less complicated for you. So I'm excited to share a little bit about that tonight. But about me, I am Christina. I am an SLP and a certified dementia practitioner in the Northern Virginia, DC area. And I am currently doing my own private practice through my own LLC entirely with teletherapy, because thank you, COVID. That's what we're doing right now.
Oh gosh, yeah. Thank you, COVID, right? Yeah. With all the COVID thing, we're gonna touch into that too. But before we keep going, I just want to say thank you, Miss Cindy, for watching, and Aidan, thank you very much for commenting live there. If you got any questions, ladies and gentlemen, this is our Tuesday Dementia Training. We try to be interactive, answer your questions live, because most of the time people would ask questions after the live and we don't get back at it after a day or two, because we're all busy doing some taking care of our patients in the clinic too. But like what I said, if you have any questions, put it down there. We'll be happy to answer those questions. Oh, I see Miss Eileen there. Thank you very much for watching. Hello, hello, hello. But I guess my first question for you, Christina, or Christine, or Christina, Christina, is that, how can speech therapists help with Alzheimer's or dementia patient? I know there's no Alzheimer's and dementia are irreversible, but how can a speech therapist help an Alzheimer's or dementia patient? What are the tests that you actually do? What are the things that you actually do for them? Is it just a wasted time? Just like in physical therapy, like, oh, you're not going to do anything with them. Is it just a wasted time, or is there something really we can do to help improve the quality of life of our loved ones that have dementia or Alzheimer's?
That is an awesome question, and probably one of the most important questions that I get, because most people I come across are like, why would we do therapy right now? And really the main goal of seeking treatment with a speech therapist for dementia and Alzheimer's is to maintain quality of life for as long as possible. And we can also help that person with dementia stay as independent for as long as possible. We work on attention, memory, problem solving, and higher level thinking skills.
Perfect. So what are the tests that you normally do with them? I mean, do you identify their stages? Is there any specific standardized test that you guys do?
We do some of that. Mainly it's to look at their current functioning skills for memory and their higher level cognitive functioning skills, and we'll see if there's a big decline, that sort of thing. One of them that we do is, I believe the MOCA is one that we can use, but there's different standardized assessments and informal assessments that we give. We look at what the families and caregivers are telling us as well, and what do they need help with, and we kind of will do a lot of informal things as well as some standardized as well, but kind of a little bit of everything to answer your question, just to see where is their biggest communication breakdown occurring and can we support it.
That's right. That's right. She mentioned, ladies and gentlemen, she mentioned about slums and mocha. Actually, that's not slums of something and a mocha drink. It's actually a standardized test. Could you explain to us what the slums mean and then the mocha mean? I'm not putting you on the spot, but I'm sure you know that. So.
Yeah, absolutely. So basically what the slums test is, it's like a mental status examination. It's like a brief oral and written test that they give to determine diagnosis and that sort of thing. It's a lot of, I don't give it often, so I'm honestly not the best to explain it, but it'll tell you current cognitive functioning. Like it'll ask you what day of the week is it, what year are we in, what state are we in. It'll ask things like, how many animals can you name in a minute? Can you categorize? A bunch of different sort of language and cognitive functioning skills is basically what it'll do. There's like also the classic clock face. You may have seen images online about, can you draw a clock? And it'll give you a circle and see, can they put the hour and markers in the normal spots? So that's a really common one too.
There you go. There you go.
Yeah, it's kind of seeing where are they at cognitively? Are they aware of their surroundings? Can they communicate with language? And that sort of thing.
What does slums, is that an acronym?
It is. And we use so many acronyms that sometimes it's like, what even does this stand for? I can tell you though.
Yeah, go ahead and tell me.
It right here.
Yeah, I know it's St. Louis something, right?
St. Louis University Mental Status Examination.
Oh, there you go.
Yeah.
Rhonda Gaston is a speech therapist. I work with her, so I would agree with her. She's my favorite speech therapist. So nothing against you, Christina. So
none taken.
You are a second then now.
I'll take it.
You're gonna get mad at me. All right. Well, there is Joanne. Joanne, I hope I'm pronouncing your name right. She said, my husband did therapy for swallowing and now doing balance and walking. That's good. I also take him to a chiropractor. All this is helping slow down the progression of dementia. That is so good. That is so good.
That is awesome.
And Joanne said, my husband hates those tests. That is so true.
I know. Nobody likes them. Yeah. I don't give them often. Most of what I do is a lot of informal interview with families and just figuring out where is the problem and what strategies can I give you. But it's really good to have that baseline to see where they're struggling because it's helpful too. But it's not fun and they usually don't enjoy it. I try to make it fun.
Yeah. You asked me to count backwards and count 7 forward and 7 backward. I mean, I'm going to just throw you the paper. Right? Yeah. The only good thing I like is the clock. I think I'm going to do that,
The clock is fun.
All right. Well, hey, Cindy says hello from Cindy. Hey, Miss Cindy. Hello. Cindy Keene is also a dementia practitioner, so she's a good dementia lady too. So, before we keep going, could you give us any 3 tips from a speech therapist like you, an expert therapist like you, any 3 tips that we can learn from you today?
Absolutely. I mean, it's hard to narrow it down to 3, but I gave it a lot of good thought. And from the 3 that I chose to pick, the first one, I think that's most important for our caregivers to implement for people with dementia is to maintain a steady routine and keep those clear expectations for them day in and day out. If they have routine that they can expect and get used to, that really helps with the confusion and the frustration. My second tip would be to make sure you provide a lot of visual support. Visual support and any sort of tangible stimuli is huge because it reduces the demand on your impaired memory system and allows you to facilitate the ability to have meaningful interactions by being able to focus on the visual or the item that's in front of you. So whether it's labeling with words, how to use the bathroom, remember to wash your hands, or how to take a shower, or whether it's, I've seen things on the walls like a stop sign before you walk into a room that they're not supposed to go into, or to leave the front door, that sort of thing. Having those visual supports helps them get a lot less lost. And my third biggest thing that I'm a huge advocate for is making a memory book. Memory books are entirely different from photo books. Photo books, you're just flipping through and they're wonderful to have, but memory books have specific strategies to them with the layout of the photos, how much visual stimuli is on a page, written words to help with recall. And they can really help these patients be able to have conversations with people and to have a lot more meaningful communication, and a lot less of those repeating words or getting stuck in stories, that sort of thing. So those are my big things: routine, visual supports as much as possible, and really looking into the benefits of a memory book.
Oh, wow. Now, those are good tips, ladies and gentlemen. You have to listen from the expert here. So one thing I really like what she told about is the visual cues. Those are very important, different cues, because most of the time our patients who have dementia, they cannot understand one single cue. You have to give them multiple cues, whether it's visual, verbal, or what do you call this?
A visual, verbal, you can say like a tactile cue.
Yeah, tactile cues. So you have to give them more cues, feedbacks, more feedbacks. And another thing that she mentioned is about the memory book. There's this product that actually sponsors us. Shout out to Remix. Remix is a tablet. Actually, by the way, I don't have it here. I should be shouting them out because they pay me, right? It's like a tablet. And actually, when you pull it out on the charger, it brings back some good memories from that patient, from that person. It links up with the caregiver's app, and it plays some music that is uploaded by that family member or what is appropriate, and it could be uploaded. You could upload a picture and some memories that you have. So it's more like a tablet. It's just like what Christina was talking about. It's like a memory. What do you call this? Memory book.
Yeah.
Memory book. Cindy said also recognizes the need to pause for the cognitive delay. That is so true. That's so true. You need to wait for how many seconds? You have to wait for how many seconds before we could answer back? 90 seconds. When we are queuing, it's like what Cindy said, when we are queuing your loved ones, when you're queuing or actually instructing your patients, you have to wait for 90 seconds. So Cindy said 30. So the longer the better, right? The longer the better. Well, anyway, there's another question here for you, Christina.
You got it.
From Lay. It's a good question. How do you deter someone who wants to go for car rides for several hours, 3 times a day?
That's a really good question. And that can be a bit of a tough one. I take it back from a verbal repetition standpoint. So if they're getting stuck on something that they want over and over and over again, I try to find a way to guide the conversation to specific topics to get them onto something different that's more productive for them. And that's something I do with the memory books. Gently guide them back to a different stimuli to try to get them away from sticking with that one thing over and over again. And you can also soothe them with something that we learned in our caretaking training that we did, was you can give them chocolates or lollipops to just kind of get them quiet and doing something with their mind on something else, some sort of sensory stimuli to distract them from perseverating on a topic. Would you add anything else to that, Mike, that you might try?
Oh, yeah. Thank you for throwing the question back to me, huh?
No. So speech therapists too are good at communicating back and forth.
I agree with Christina. That is a very, very good question. And it's a broad question. So if that's the case, okay, for example, you got a loved one or a patient or a person that you're taking care of that has that situation, you have to identify what is the root cause. Why are they wanting to ride a car? Why? You have to know what stage they're at. If they're in that early stages, that's going to be very difficult because they're in that denial and anger stage. If they're on that mid or later stage, okay, it's easier for them to be redirected. So you have to know what stage your loved one is. And that's why you need to go to a therapist or a physician and properly assess what stage your loved one is, because different stages have different approaches. So let's just say the patient or your loved one is in a later stage. when the person is asking, hey, can I go out for a car ride? Can I go out for a car ride? You can actually redirect them, like what Christina said. Give them something to eat, sensory stimuli, something like a chocolate or a lollipop or whatever. Or in my case, I'm a physical therapist. We ask them the question. We ask them a question. Why do you want to ride the car, mom? Why do you want to go out, mom? And then they will, you just have to extract that questioning there. Or, you redirect them to another activity. Okay, let's go on to the bathroom first. Let's go on to this area first. Okay, so those are what you call redirective activities for your loved ones. So like what I said, every stage is different. Every patient is actually different. There could be an underlying reason. Maybe they just want to get up and stand up, right? And go to the bathroom. Or maybe because they just want to, because that's the time of the day that they go to work, right? Or maybe because they just want to go out and just actually ride around. Maybe that's their routine. I get out of the house around 8 o'clock in the morning, to go to work or go whatever. And in my head, that every 8 o'clock, I need to go to work, right? What more for our loved ones who's been doing that for like 60, 70 years or whatever. So every patient is different. Every person is different. Every stage is different. So you really need to go and talk to a good therapist that will actually understand your loved one's current condition. So I hope that answers your question there, Lay. And of course, whoever's all our practitioners out there, so maybe they could put in their suggestions there. Anything else, Christina?
Yeah, I figured one of the most helpful things I can give this group as a speech pathologist to talk about some tips for talking with people who have dementia, because that can be very, very challenging. So maybe we can cover a little bit of that together.
Go ahead.
All right. So one thing that I'd like to start off with is that repeating key information to them to help them stay focused is huge. If you need them to be safe, you repeat those key information that you need them to do. You also want to make sure that you're always speaking slowly and clearly to them. If you start coming in talking really, really fast, throwing a lot of questions or a lot of different ideas at them, it can be very confusing and overwhelming. So you want to speak very softly, slowly, and clearly when speaking with them. Something that Mike also had said, but I'd like to touch on some more, is that you want to give them choices instead of just give choices and not just ask open-ended questions. It's great to ask them why to extract what it is that they want, because depending on the level of the dementia where they're at in that stage, they may be able to answer. But as they start to progress, that will become more and more confusing to them as it impacts the language center of your brain. So instead of just saying, what do you want to drink right now? That might be too overwhelming for them. You could say, do you want coffee or do you want tea? And again, this very much varies based off of what stage of dementia they're at, because in the beginning stages, they may really enjoy that power in choosing what it is that they want. But as they progress, they may need a little bit of help with that recall. Also, provide information to them in short and simple spurts. You don't want to be too overwhelming. You want to make sure that you have smaller, shorter phrases when communicating with them so that they don't get too lost and you don't give them too much at once. We want to process in smaller bits, kind of think of chunking strategies for memory. Always remember to use visual support, whether that is writing words out or pictures, to help with tasks in daily living and help increase their ability to be independent. So you may post pictures that show them how to get dressed, or take a shower, that sort of thing, to help them stay independent. I have one patient I work with now that really, really loves to make her coffee. That's her favorite thing in the world. So what we do is we create a visual to help her follow the steps of using her Keurig so that she has independence in her ability to do that. And overall, just reminders as a caregiver, you give them reminders about appointments, medication, when to take it, and that sort of thing to keep them safe. But probably the last important thing I'd like to mention too is when you speak with them, how do you do so from an emotional standpoint? Do you look bored and frustrated, or are you happy and showing them with your emotions that you want to be there? You always want to make sure that when they're telling you a story, you're receiving it well, you're smiling, you're engaged, because they feel your emotions more than anything. So even if you're feeling frustrated and you need to take a step away, come back and make sure you give them your best, happiest attitude, and that you're always being positive and lifting them up. And I think that helps a lot with the frustration and those communication breakdowns.
How can you be positive in this? A lot of my
Yeah.
caregivers that I educate, how can I be positive, Michael? But there's always, it's all about looking at the situation, glass full and glass half empty, half full, something like that. But going back
Yeah.
to what Christina was talking about, thank you for all those tips. I really appreciate it. I was actually writing it down.
You're
So
welcome.
first thing that she said is repeating key info. It only means you're actively listening.
Mm-hmm.
When you're talking to somebody, you want somebody actually actively listening to you. There's the difference between hearing and listening. You may be just hearing that person's voice, but are you really listening to it? And same thing when you're taking care of a patient or a loved one that has Alzheimer's or dementia. Are they saying they want to go to the car, or are they just saying they want to go to the bathroom? Are they saying they want to eat egg, but actually what they really want is just water? So there's a difference between hearing and listening. You have to learn how to listen. How do you listen? You're not just only hearing it. You're actively looking at the cues. Are they cold? Are they hot? Are they uncomfortable? We're only talking for like 20, 30 minutes right now. I'm sitting in a nice, fancy, comfortable chair. I have a pillow right behind me here. I'm already uncomfortable. Imagine that. What more for your loved ones who's actually sitting in a wheelchair and they have a poor posture, poor support, and a wheelchair that has a sling chair, and your bottom is in a uneven posture. And guess what? Their pelvis, or whatever you call that, your pelvis or your lumbar, your low back is sideways like this, and they're like this, and they're like this. They have a history of stroke. And then and they want to just stand up a little bit and move. And here you are telling, hey, sit down, sit down, sit down. Guess what? And then you start getting agitation, right? So you have to learn how to listen and hear. There's a difference between hearing and listening. All right. So what's the next thing that Miss Christina mentioned? Speak slowly. I make that mistake. English is not my first language. You know how I mask my English? I speak faster. I speak faster because I just want to finish my language. I just want to finish what I'm talking about. But you have to really change your words. You change your action, because here you are. If you are a care partner right now, if you're a caregiver, whether you're a therapist, a nurse, an actual caregiver, taking care of them 24/7, you cannot change a dementia patient. You cannot change it. Let's face it, it's going to get worse. What you can change is your approach, your behavior towards this condition, towards the patient. So how do you change it? Change your words. You change how you talk to them. You change how you ask them questions, because there's power over what you say as a caregiver or a care partner. Because so she said, speak slowly. If you will just catch yourself in speaking slowly, your mood will go down a little bit, your hyperactivity will go down a little bit, and they will listen to you more. All right. And in connection with that, on her third suggestion is the choices. You see what she did? She just gave you some options how to ask questions. So instead of asking open-ended question, ask a close-ended question wherein you can get at least a 50% chance of getting the right answer. And you empower your loved one, you empower your patient, and they feel like, oh, I'm part of the decision-making process. Right? Okay, I'll stop talking. And then fourth.
You're doing great.
I know, right? Thank you. Oh, I'm doing good. Fourth, short information. Stop explaining so long. I do that all the time. I'm explaining so long right now. I'm going to do that. Short information. Number 5, visual support. Give them some visual cues. Pointing it. So, for example, you want to go to the bathroom, point to the bathroom. If you want to eat, if you want them to eat, do that motion too. Just the other day, I was at the psych hospital, and this patient was just really like in this position. I was pushing her head. I was positioning her how to go to the midline. She's just resisting because she has that called what you call pusher syndrome. You know what I did? I just told her, follow what I'm doing. So I was just waving at her. I was waving at her. I looked crazy doing that session. I was like, okay, move along this way, Miss. I'll just say Mrs. Smith, right? I will move along, Mrs. Smith. And during that session, she was like moving small increments, and slowly but surely she was sitting up straight. But when I was actually pushing her, she was resisting. She was resisting because she has what you call the pusher syndrome, wherein they're pushing against that stronger area. So because she's like this, right? And I was pushing her. So her tendency is to push back. But when I told her, follow what I'm doing, I'm just waving at her. I'm not touching her. I'm just waving at her. I'm just moving, doing this motion. You know what? She was slowly did this. And same thing with life. When you're trying to push something, push your ideology, push your situation, guess what will the other person will do? They're going to push you too. And same thing with taking care of an Alzheimer's or dementia patient. If you push and insist what you want to happen, they're not going to cooperate with you. You just have to go along with it, like what I was doing. Go along with it. All right. Last but not the least, mirror. What you said, mirror, because they will mirror what you're saying or what you're doing. If you're smiling, guess what? They're going to smile at you too. If you're frowning, they feel it. The dementia patient, the patient with dementia, they feel you. They feel you. I mean, I'm not saying I have dogs here. They know when I don't feel well. You know, I'm not saying animals or human beings there, but they feel. I mean, they feel you. They may not be able to express it, but they still feel you. The energy that you project, the power that you project, the energy. Are you coming in are you enjoying that session with them? So you follow this, what I do. Every time I pass through a door, I just change my behavior. That's my cue. If I pass through a door, I go through a door, pass through a door, whatever you call that in English. When I go through a door, where's the doorpost, I try to catch myself. I'm going to change my behavior when I go through this door. And same thing when taking care of a patient, taking care of a loved one. You have to find the cue. You have to find the cue for yourself, because you have to catch yourself to change your words. You know, your words are actually going to be powerful for your loved ones. All right, I'm going to stop talking. Go ahead, Christina.
No, I think it's great. All these things you're saying are so wonderful, and I'm really happy we've been able to talk about it, because these are just a small tidbit of the amount of strategies that a certified dementia practitioner can really provide to our clients and their families and these caregivers. There's just so much to it. I think one of the biggest things I usually start off with telling clients or caregivers is, if you can tap into recognition memory, it's so much better preserved than the recall memory. So meaning when you have those visuals, it's good stuff. So when you have those visual supports through writing of words, through dancing and the motions you were doing, through photo books, anything like that, that memory is so much better preserved for their recall to make them live a happier life versus having them just recall independently. It's just so much. And when we think about how frustrated we get when we don't know the name of something, we're like, oh, what's it called? What's it called? Well, throw in confusion into the mix and you'll get all kinds of agitation and communication breakdowns. So we just work hard to figure out what type of strategies we can provide you with. And I think that recognition memory is like one of my key takeaway points from this webinar tonight, is to just find ways to be creative and help these people with dementia recognize things that are familiar to them, that make them happy, that can make their lives better. And it helps a lot.
Perfect. Thank you very much. I love that. I love, she said recognizing therapy versus recalling therapy. Is that how you say it?
Yeah, it's recognition memory versus recall memory. It's same sort of thing. It's like the strategies that you do in therapy.
Oh gosh, there's a big difference between recognition and it's way past my English time. Recognition.
Yep.
Recognition memory versus recall memory.
Yes.
Oh gosh, that is very powerful, because I cannot recall what I did this morning, but I can recognize what I actually really did. That makes sense.
It does.
That makes sense.
I often think of exams when I'm explaining this to families. If you are given a multiple choice exam, you're like, yes, okay, the answer is somewhere on this page. I'm going to figure it out. versus when you get a packet of tests that's just like essay format and you're like, oh no, this is way harder.
Yeah.
That's exactly how it is for our patients. So that's the best example I usually like to give to help them realize, oh gosh, this is why this way is so much easier for them.
Oh gosh. Well, thank you very much, Christina, for sharing all your knowledge for us here in the Alzheimer's and Dementia Support Group. So where can we reach you? Do you have an email or any website that we can go to?
I sure do. I just launched my website. It's carebychristina.com, and that will give you all the contact info you need to reach me on social media, email, or by phone.
Cool deal. So carebychristina.com. Check that out, ladies and gentlemen. Again, I appreciate you, Christina. Appreciate you, ladies and gentlemen, Alzheimer's and Dementia Support Group. But before I let you go, always remember the word FAST, F-A-S-T. Why? Because speed wins. F-A-S-T. You got to take action fast. Letter F, find friends that will push you to your next level because you are the average of the 5 people you hang out with. If you're hanging out with awesome therapists, awesome people, awesome caregivers, guess what? You're going to be awesome. And if you need to find people, you need to find a support group. Go to a support group locally, your Alzheimer's Association, your go to your doctor, your physician. Find them because they can give you a support group in your local area because there is a support group there. You might just don't know yet. All right. And then letter A, you got to learn how to take action. All this stuff that we're doing, it's not going to do you good. It's not going to do me good if you don't take action on it. It's a free seminar, free training that we do every Tuesday. Like what I said, it's not going to do me good. It's not going to do you good if you don't take action. And letter S, you got to learn how to share and subscribe. Share this show, share this podcast because it's going to be streaming too in our YouTube and also in our podcast episodes. So share and subscribe in our podcast. And last but not the least, letter T, teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's what Christina's here for. She's teaching us. She's teaching us because the more she teach it, the more she'll understand it. And same thing with you when you're taking care of your loved one as a caregiver. The more you teach people about Alzheimer's and dementia, the more they'll know you, the more they'll understand you, the more they'll understand their loved ones. All right. Any last parting wisdom for us, Christina?
I think that's all today, but thank you so much for having me. It's really been an awesome experience and a blessing to connect with everybody. So I appreciate the time and the ability to be here.
All right. Well, again, thank you very much. I'm going to put up our slide here again. I'm going to play some music. And again, thank you very much, ladies and gentlemen. Appreciate you.